Your body runs on precise biochemical systems, and this nutrient plays a central role in DNA synthesis and cellular metabolism. When levels decline, the body rarely signals it clearly. Instead, early signs can be subtle, from persistent fatigue and headaches to changes in nerve function. These signals are easy to overlook, but they matter. Detecting B12 deficiency early is important, as prolonged deficiency has been associated with neurological changes that may become difficult to reverse over time. Vitamin B12 status depends not only on dietary intake, but on a tightly regulated absorption process that is often underestimated. A central component of this system is intrinsic factor, a protein produced by specialized parietal cells in the stomach. The protein binds to vitamin B12, allowing it to move through the digestive tract for absorption in the small intestine. In the absence of this step, even a nutrient-rich diet may not be sufficient to maintain adequate levels over time. Structural changes to the stomach can significantly disrupt this pathway. Individuals who have undergone bariatric procedures, such as gastric bypass or sleeve gastrectomy, often experience a reduction in parietal cell mass. As a result, intrinsic factor production may decline and gradually impair the body's ability to absorb B12 efficiently over time. In other cases, the barrier is not surgical but immunological. Pernicious anemia is an autoimmune condition in which the immune system targets either the parietal cells or intrinsic factor itself. Consequently, vitamin B12 cannot bind effectively or be absorbed in the small intestine. Taken together, these mechanisms highlight an important point. Deficiency often reflects impaired absorption, not simply inadequate intake alone, which is why underlying causes must be carefully evaluated. Beyond structural and biological barriers, vitamin B12 status can also be influenced by medications commonly used for other chronic conditions. One well-documented example is metformin, a first-line therapy for managing blood glucose in individuals with type 2 diabetes. Clinical observations suggest that prolonged use, even over several months, may be associated with a gradual decline in B12 levels, particularly when not routinely monitored in clinical settings. The mechanism appears to involve altered absorption in the small intestine, although the exact pathways are still being investigated. Over time, this may contribute to subclinical deficiency, which can remain unnoticed until symptoms begin to emerge or progressively worsen. A similar concern applies to medications used for acid-related conditions. Histamine H2 receptor blockers and proton pump inhibitors reduce gastric acid production to relieve symptoms of reflux and heartburn. However, adequate stomach acid is necessary to release vitamin B12 from dietary proteins. When acid levels are chronically suppressed, this step becomes less efficient. Because these medications are widely used, this interaction is frequently overlooked. In some cases, long-term use may contribute to impaired absorption, reinforcing the importance of periodic evaluation in individuals at higher risk. When absorption barriers and medication-related effects are not addressed, the consequences begin at a fundamental biological level. At a cellular level, B12 supports DNA production and metabolic efficiency, processes that are essential for maintaining normal tissue function. With declining B12 availability, these core pathways become less efficient, initiating a cascade of disruptions across multiple organ systems over time. One of the earliest effects is reduced efficiency in energy metabolism. Cells are less able to generate energy effectively, which may contribute to persistent fatigue and decreased physical capacity in daily life. At the same time, red blood cell production becomes impaired. A reduction in healthy red blood cells may follow, limiting the body's ability to transport oxygen efficiently and deliver adequate oxygen to tissues throughout the body. The nervous system is particularly vulnerable. Adequate levels are required for the maintenance of myelin, the protective sheath surrounding nerve fibers. When levels are insufficient, this protective layer may deteriorate, affecting nerve signaling. In addition, metabolic byproducts such as methylmalonic acid can accumulate, which has been associated with neuronal stress and functional decline. Together, these overlapping effects help explain why deficiency can present with diverse symptoms and why early recognition remains clinically important. As disruptions in energy metabolism and red blood cell production begin to develop, one of the earliest noticeable signs is a distinct pattern of fatigue. Unlike general tiredness, fatigue associated with B12 deficiency is often described as exertional. In practice, energy levels may feel relatively stable at rest, yet even mild physical activity or modest cognitive effort can lead to a rapid and disproportionate sense of exhaustion. This pattern is closely linked to impaired oxygen delivery. When red blood cell production is compromised, the body has fewer healthy cells available to transport oxygen efficiently to tissues. As a result, muscles and organs are less able to meet increased energy demands during activity. The sensation is not simply sleepiness, but a reduced physiological capacity to sustain effort. Some individuals may also notice accompanying symptoms such as shortness of breath or awareness of a faster or irregular heartbeat. These responses can reflect the body's attempt to compensate for reduced oxygen availability. Because these episodes often improve with rest, they may be dismissed or attributed to routine stress or fatigue. Recognizing this activity-related pattern may be important, as it may provide an early clue to an underlying vitamin B12 deficiency. When exertional fatigue and cardiovascular strain persist, underlying disruptions in red blood cell production may begin to appear through visible changes in the skin and eyes. Vitamin B12 is essential for proper red blood cell maturation within the bone marrow. When levels are insufficient, this process becomes impaired, leading to the production of larger, structurally abnormal cells that are less stable and more prone to breakdown. As a result, the number of fully functional red blood cells circulating in the bloodstream declines. Over time, it may contribute to a noticeable paleness or a slightly sallow tone in the complexion, reflecting reduced oxygen delivery to peripheral tissues. In more advanced stages, the breakdown of these abnormal cells may accelerate. Bilirubin levels may increase as a result, a yellow pigment generated during the normal turnover of red blood cells. When bilirubin accumulates, it may lead to jaundice, characterized by a yellowing of the skin and the whites of the eyes. Unlike normal variations in skin tone, such changes reflect an underlying physiological imbalance. Recognizing them early may provide a useful visual cue that blood cell production and turnover are no longer functioning optimally. Visible changes in the skin may offer general clues, but the oral cavity often reveals more specific clinical signs of vitamin B12 deficiency. One of the most characteristic findings is glossitis, an inflammatory condition that alters both the appearance and texture of the tongue. In a subset of cases, the tongue may appear swollen, reddened, and unusually smooth. Many individuals report a persistent burning sensation or an uncomfortable tingling feeling across the surface. Such changes are closely linked to impaired cellular turnover. Vitamin B12 plays a critical role in cell regeneration, and when levels are insufficient, the papillae, the small projections that give the tongue its textured surface, may gradually diminish. As a result, the tongue can take on a glossy, flattened appearance. Functional changes may also occur. Some individuals experience a reduced sense of taste or notice an unusual metallic taste. These sensory alterations can further indicate underlying disruption in tissue maintenance. However, these findings are not exclusive to B12 deficiency. Similar symptoms may arise from iron deficiency, certain infections, or medication effects. When these oral signs appear alongside fatigue or other systemic symptoms, further evaluation can help clarify the underlying cause. Headaches have been observed in association with low vitamin B12 status in some studies, extending beyond more visible physical signs. Clinical observations have noted that individuals experiencing migraines often present with lower serum B12 levels compared to those without recurrent headaches. Although the exact biological relationship remains under investigation, several plausible mechanisms have been proposed. One leading explanation involves elevated homocysteine levels. When vitamin B12 is insufficient, the body's ability to metabolize this amino acid is impaired, leading to its accumulation. Higher homocysteine concentrations have been associated with oxidative stress and endothelial dysfunction, which may affect blood vessel integrity and cerebral circulation. Additional factors may also contribute. Impaired red blood cell production can reduce oxygen delivery to brain tissue, while disruptions in nerve function may alter pain signaling pathways. Together, these effects could increase susceptibility to headache episodes or influence their severity. Observational findings in pediatric populations have also drawn attention to this association, with headaches frequently reported among children with low B12 levels. While these findings do not establish causation, they highlight a meaningful correlation. Recognizing this link may be clinically relevant, as recurrent headaches could reflect an underlying nutritional imbalance requiring further evaluation. Neurological involvement represents a more advanced consequence of prolonged B12 deficiency, reflecting direct effects on nerve structure and function. When B12 levels decline, the protective sheath that surrounds nerve fibers and supports efficient signal transmission may gradually deteriorate, leading to impaired nerve conduction. Peripheral neuropathy may develop as this process progresses, a condition characterized by abnormal sensations in the extremities. Common symptoms include numbness, burning discomfort, or a persistent pins and needles sensation in the hands and feet. These sensory changes often develop gradually and may initially be subtle, making them easy to overlook. Clinical interpretation can be complicated by overlap with other conditions. The presentation of B12 related neuropathy closely resembles diabetic neuropathy, with similar patterns of tingling and pain. As a result, symptoms may be attributed solely to glucose-related nerve damage, particularly in individuals with diabetes. The overlap is further complicated by treatment factors. Certain medications used in diabetes management have been associated with reduced B12 levels, potentially contributing to or worsening deficiency over time. Recognizing these neurological symptoms as potentially nutritional in origin is important, as early identification may help prevent more persistent or progressive nerve impairment. Progression of untreated vitamin B12 deficiency can extend beyond peripheral nerve involvement and affect the central nervous system, including the brain. At this stage, symptoms may shift from primarily physical discomfort to measurable changes in cognitive and psychological function. Individuals may report difficulties with memory, reduced concentration, or a general sense of mental slowing, often described as brain fog. Observational research has linked lower circulating B12 levels with poorer cognitive performance, although the strength and direction of this relationship may vary across populations. Such findings suggest that adequate B12 status plays a role in maintaining normal neurological function. In more advanced cases, disruption of myelin integrity and neurotransmitter balance may contribute to more pronounced neuropsychiatric symptoms. These can include mood disturbances, changes in perception, or altered thought patterns. In prolonged and untreated deficiency, cognitive decline may become more apparent and functionally limiting. Importantly, the course of these changes is not always irreversible. Early identification and appropriate management may improve neurological outcomes, particularly before structural damage becomes more established. Recognizing these cognitive and behavioral changes as potential medical signals, rather than attributing them solely to stress or aging, may support earlier evaluation and more effective intervention strategies. Accurate diagnosis represents a critical step in addressing vitamin B12 deficiency, particularly because standard testing does not always capture the full picture. Serum B12 measurements are commonly used way in clinical practice, yet normal values do not necessarily exclude deficiency in all cases. Some individuals may develop what is referred to as a functional deficiency, where circulating B12 appears adequate, but cellular utilization is impaired. To clarify this discrepancy, clinicians may assess additional metabolic markers. One of the most informative is methylmalonic acid, often abbreviated as MMA. Elevated MMA levels indicate that vitamin B12 dependent pathways are not functioning properly, providing indirect evidence of deficiency at the cellular level. This approach may help identify cases that might otherwise be missed through routine screening alone. These diagnostic nuances are important because the symptoms of B12 deficiency can overlap with a wide range of other conditions. Fatigue, neurological changes, and cognitive symptoms are not specific and may be attributed to unrelated causes without further evaluation. For individuals at higher risk or those experiencing persistent, unexplained symptoms, a more comprehensive assessment may be appropriate. Early identification allows for timely management and may help reduce the likelihood of longer-term neurological or functional complications. These symptoms can have multiple causes, and proper evaluation is important to help determine the underlying condition. Thank you for watching. This content is for educational purposes only. If this changed how you think about nutrition, don't forget to like and subscribe for more science-based insights.